Welcome back to Health Made Easy, part 2 of our PCOS series. In part 1, we covered what PCOS is, different factors that play a role in it, and how it can impact all aspects of health. Now, what we're going to be diving in this video is a holistic approach to managing PCOS because you're unique and managing any illnesses or any condition does require a holistic approach to get the best results.
It is an individualized approach, right? Because I mentioned persons will present differently. So when looking at management, it's really geared at how can we help the body to respond better to the insulin so the levels can go down, so the blood sugar can be regulated better. How can they improve the hormones that's going array, going up and down, causing all these issues? Achieving a healthy body weight, and I'm going to talk a little bit more on that, regulating menstrual disturbances, addressing fertility concerns, and managing other conditions or symptoms that a patient may be having. So this is why it's so individualized approach to it. And as I mentioned, a multidisciplinary care where you're seeing different specialists, whether it's you're going to be seeing your family physician or you're going to see an endocrinologist, the obstetrician and gynecologist or psychiatrist, right? So there's different things to think about when we're talking about polycystic ovarian syndrome. The primary thing that we would start with is usually lifestyle changes or lifestyle modification, because we found that making lifestyle changes can have significant effects when it comes to managing polycystic ovarian syndrome. However, some persons do require that they are started with both lifestyle and medication, right? Or medication might be added later on. So when you get medications, it's depending on whether persons want to get pregnant or not. So that's one of the things where it helps to decide what medication to start using, regulating your cycle. Well, so you might be going on the oral contraceptive, for example. Going to acne, so you might be going to a dermatologist or the physician can treat. Getting excessive hair growth, anti-diabetic medications to help with insulin issues, to regulate cholesterol levels. And there are also some minor surgical procedures as well. Now, moving on to the lifestyle modification, the big part of it, right, of the MISA treatment for polycystic ovarian syndrome. Now, I mentioned one of them being achieving a healthy weight or healthy body composition, right? And if you've heard me in my talks before, body composition is because sometimes you can be of a healthy weight and still have unhealthy, excessive fat, whether it's around the midsection or around the organs. But just keeping it here for simplicity, talking about achieving a healthy weight. Now, this is so important for persons who are overweight or obese or have that excess weight, because studies have shown over the years, just by getting a 5% weight loss reduction can improve your symptoms drastically.
Hormones can then become balanced, ovulation can return, and fertility can improve. So as you can see, weight management can play a huge role in the management of PCOS.
Right, so, and of course, that goes with dietary changes, physical activity, adequate sleep, and stress management.
I will go more in depth with these as we continue.
Now, moving on to other lifestyle modification, and why I split them apart like that is because whether or not you're out of a healthy weight, no, physical activity is going to be important. Diet is still going to be important. Like what you eat is going to be important. So that's why they're separate here. So physical activity, many times when we hear exercise, we're thinking about for weight loss, but it has numerous benefits, especially if you're someone who has polycystic ovarian syndrome. So for the exercise, now it is very crucial part of management for persons with PCOS. So it helps to actually help your body respond better to that insulin. And we've seen how important it is to have insulin levels regulated better, because we've seen what it can cause when it's not at its right level. So exercise helps your body to respond better to insulin. It helps to lower the insulin levels as well, and also helps the hormone levels to get back in balance and restore your ovulation, helping back your cycle to go back in normal. And it also releases that happy hormones as well. So for persons who are sad, depressed, it does help with that as well. So it has beautiful benefits. And what is usually recommended is at least 150 minutes per week, which works out about 30 minutes 5 times a week, and to include some type of strength training. But of course, nothing excessive. I always recommend that you speak to your physician before making any major changes to your exercise regime. Assess type of exercise is safe for you, the intensity as well. Similarly for your diet, which is what we're going to talk about now. So same thing applies, that before really making any significant changes to your diet, to really have that discussion with your healthcare team. Very, very important, especially because management can be different for the various persons depending on any underlying illnesses, medications, etc. Now, when we're talking about the healthy eating habits, for example, it can be grouped very big, various subtitles, so I'll split up a little bit. But think of it like having regular, small, frequent meals that are balanced. And you want to be mindful of portion size as well. And ideally, eating healthy involves having mainly vegetables and fruits, whole grains, healthy fats, and healthy proteins. So having those more often than the less healthy foods, which I'll mention a little bit. So let's say we're talking the whole grains. Really, what I recommend is having more of whole grains, more than the refined type of carbs. So like choosing brown rice over white rice. So it's just limiting those that tend not to have so much nutritional benefits and having more of those that have more nutritional benefits. Then if we're talking about protein, for example, so having more fish, more poultry, beans, peas, nuts, and while limiting red meat and dairy. So it's not that you're removing it, it's more having a nice balance where you're having more of the ones mentioned first. And one of the beans, which I'll talk about more, that's very good is soybeans, because they found that soybeans has something called isoflavones. And what it does, it helps to regulate hormone imbalances, and that's also, of course, to help with polycystic ovarian syndrome. Now, with the healthy fats, for example, to give you some idea of some examples of it, it can be like olive oil, avocado, nuts and seeds as well are examples of it. And what's important is getting some omega-3, or you hear fish oil. We can get those from your food, like from salmon, for example, from sardine. You can get those from the food itself, and those are very good in terms of helping to, again, helping with healthy cholesterol levels, helping with that insulin problem that persons generally see in PCOS. Or it's an example of what the refined carbs were that I mentioned that you prefer to limit, because those food worsen inflammation, which is also seen in PCOS. So I mentioned different things to try and eat more of. Also want to limit certain things like foods high in salt, sugar, saturated fat, reducing that processed foods, limiting red meat, limiting alcohol as well. So you're not restricting, it's just that you're making the decision to have more of the foods that are going to help optimize your health. Now, I wanted to go back to here with the fruits and vegetables and whole grains, because they offer something called fiber as well, in addition to vitamins and minerals. But fiber is really, really good. And unfortunately, we all over the world, the population tends to get too little bit of the fiber. And we generally need 25 to 30 grams per day. For somebody who has PCOS, sometimes, depending on the person, we may recommend higher, to about 40. Depends on, again, we'll talk with the patient and figure out if it is that they need something higher. And so you can get fiber from vegetables, fruits, and whole grains. So one of the things you'll notice is that having a diet that is rich in those fruits and veggies, whole grains, healthy protein, healthy fats, you tend to meet the nutritional needs of the vitamins, minerals, everything that you need, having that nice little balance. Now, one of the things that we recognize is very common in persons who have a PCOS is that there are some vitamin and mineral deficiency, which means that there are some vitamin and minerals that can be low that we see in persons with PCOS. I've listed a few of them here. And the thing about it is that these vitamins are very, very important for several things, but I'm going to be discussing specifically to PCOS now. Just to sum it up, these can help, having a right amount of these can help to improve the insulin problems, which can help to regulate better blood sugar levels, help with weight management, help with the reproductive functions, so that's getting back your menses under control, helping with fertility as well, also helping with cholesterol levels. So they have powerful things that can help when we have them at the right balance. And so we notice that persons are low in these vitamins. There are different reasons why persons might have a low vitamin and minerals. So that's why, again, where your physician usually would take that full history from you to find out what's going on. What is there something else that's going on with you? And just to list a few of what's the vitamins like vitamin D, E, vitamins B, selenium, zinc, calcium. But having that wide variety of fruits and vegetables, plus having a nice balance of other whole grains, protein, do help you to meet those things and to have that nice balance of nutrients in there. The thing is that sometimes we are eating the right amount of fruits and vegetables in terms of the right servings.
However, a lack of variety in our diet can often lead to us missing out on key nutrients. For instance, relying on just a few options like lettuce, tomatoes, and bananas may provide some nutrients, but
having that different variety where you're having fruits and veggies from that rainbow, as we call it, helps you to get something called phytonutrients in addition to what we mentioned before. And phytonutrients are so powerful. They help your body to get rid of oxidative stress, to get rid of those toxins as well, as I mentioned before. So it helps to reduce the effect that those toxins I mentioned, like BPA, other exposures you get from pollution. It helps to protect your body, your cells against it. And so having that nice variety from the rainbow and including other foods as well does help you to stay along that, to stay unhealthy, and again, helping you manage those PCOS symptoms as well. So all of these you would see are different colors of fruits and veggies. So soy is considered more of a protein, but I mentioned before how powerful it is, and it is a phytonutrient. Dark chocolate is not a vegetable, but it does have some powerful antioxidants as well that helps. Of course, whatever we're doing, we want to remember moderation. No matter how healthy it is, we still want to be keeping in a stock of that, want to be having everything in moderation, because too much or too little of something can cause any problem. So other things here that are not vegetable fruits like ginger and turmeric and cinnamon, other things that are have phytonutrients that have been shown to help with just regulating or better insulin levels and regulating hormonal levels as well. So again, it's more just having that nice balance. And let's not forget to hydrate as well. Hydration is very, very important for anybody, but also important as well for someone who maybe have polycystic ovarian syndrome. And of course, you talk to your physician just to find out your target goal of water intake. And if you're someone who doesn't like water, there are different ways to spice it up. Green tea is a nice way for hydration. I can also think about adding sparkling water with fruits in there, infusing it. It's a nice way to get a taste to hydrate without the excess sugar.
Stay tuned for part 2, where we'll dive even deeper into a holistic approach to PCOS. Be sure to hit the subscribe button and turn on notifications, because you're not going to want to miss the next tips that we'll be sharing.